Now back to our top story. If you have kids back in class this month or return to an office setting yourself, you might have noticed that a lot of people are out sick. Now, that can be common with students and teachers and dreaded back to school germs at this time of year. It's probably just the common cold, but as we head into the colder weather, we certainly face more viruses, some that we haven't had to deal with as much during the pandemic. And the flu nearly disappeared the last 2 years, with many of us wearing masks, social distancing, and not traveling as much, trying to protect ourselves from COVID. So health leaders are monitoring the flu season in the southern hemisphere to get an idea of what it's going to be like for us here in the northern hemisphere and in the U.S. And it's not looking good. Countries like Australia dealing with one of the worst flu seasons in years. So joining us live right now to talk about this is Dr. Nancy Nielsen. She is Senior Associate Dean for Health Policy at the University of Buffalo Jacobs School of Medicine. Dr. Nielsen, it has been a while since we've talked. It's nice to see you. Thanks for coming on.
Good to see you, Michael.
So it's interesting that we can look at what happens in a place like Australia because obviously these things are seasonal, right? And so what typically happens there is what comes here. So as you kind of look at that, study the data, how bad of a flu season are we expecting here in the U.S. and how is COVID still a factor in that?
Well, yes, COVID and flu are both expected to be circulating this winter. You're absolutely right. Looking at the southern hemisphere gives us a preview of what we can expect here. Now, that doesn't always play out, but we do think this is probably going to be a much worse flu season than we've seen the last 2 years when we were dealing primarily with COVID. But COVID's still going to be here.
The question that we're getting the most from people right now, and certainly wanted to ask you, is about the timing of all of this, the best time to get your flu shot for maximum protection, and then if there are any concerns about getting it at the same time as a lot of people are now getting this new COVID booster or just COVID vaccine, kind of the new one to deal with the variants that are out there.
Well, the new vaccine is important. It's important to get it. I got mine yesterday along with the flu shot, one in one arm and one in the other. So I would say right now, I certainly would get it as long as the government is continuing to pay for all of this, which at some point they're going to stop doing. So yes, get it now. You'll be protected for the winter. But we have to also be reasonable. If you look at Erie County, we are in the moderately high category. And so as winter sets in and more people are indoors, you may want to think about whether you ought to wear a mask when you're out in public with people that you're not around usually.
There are certainly going to be some younger kids out there, 1, 2, 3 years old who have never had the flu and who, are, I guess you could call them pandemic babies, right? Their whole lives we've kind of been dealing with all of this. I've read out there that there is some concern that they could be especially at risk now with flu season coming. And then also, what about the elderly?
Well, flu has always been the most difficult for the elderly, always has been and will continue to be. Kids will do better. Kids will do better with COVID as well, but we should protect ourselves as best we can. So right now, the new vaccine for COVID is bivalent. What that means is it works against both the original virus that started all of this mess almost 3 years ago, and the BA4 and 5 variants that were so very contagious. So that's going to be very good protection against COVID. For flu, one of the problems is getting people to protect themselves against flu. The uptake of flu vaccine every year is somewhere around 50%. It's too bad. But I certainly would encourage everybody who is eligible to take both vaccines, and I would do it now.
There are some health officials out there who aren't worried about the flu and COVID hitting people simultaneously because of something they call viral interference. Are you among those health experts that you don't believe it's going to be this bad 1-2 punch?
Viral interference is real. There's no question about that. But that doesn't mean that you can't get COVID and then later on in the winter get flu. So again, their point is with the timing, a simultaneous infection with both. I'm less worried about that than I am with people who are vulnerable getting sick during the winter from one or the other, or both during the winter, even if it's not at the same time.
Dr. Nielsen, we've got a little bit of time left. We talked a lot over the past, couple of years about the COVID vaccine. Initially, we thought it was going to be really effective at preventing people from even getting the virus. It turns out it remained really effective at keeping you alive or keeping you out of the hospital, but especially with Omicron, it's not doing much to keep us from getting infected. And so, there are people who are suspicious about that vaccine. Do you worry that that spills over now and that fewer people are getting, these other vaccines, including the flu vaccine, as we're now talking about flu season?
I think there's no question that people have virus fatigue. They're tired of hearing about vaccines. But the reality is this new vaccine is really much better. And yes, the older vaccine did not protect as much against getting infected, but it certainly kept people out of the hospital. The newer one should certainly protect us even against getting infected. Although obviously there's the possibility that there will be future mutations, but it's so easy to make a new mRNA vaccine. That's the real beauty of this new vaccine. As you know, we get new flu vaccines every year, and they're formulated based on what the experts think is coming this year, and they usually look at the Southern Hemisphere. And the flu vaccine this year seems to match very well to the flu virus strains that are circulating in the Southern Hemisphere as well.
Dr. Nancy Nielsen is Senior Associate Dean for Health Policy at the University of Buffalo School of Medicine. Always great to see you. Thanks for your time.
Thank you, Michael.